My name is Dr. David Dupree. I'm a board-certified surgeon specializing in hernia repair, and I'm affiliated with Meridian Systems, Bayshore Community Hospital, as well as Riverview Medical Center, where I do a majority of my operating. I'd like to talk today about hernia repair, because what happens, I on the street, in the gym, in the groceries, in the supermarket, sometimes people say, "Hey doc, what's a hernia? How do I know if I have a hernia?" These are important questions because hernias can be life-threatening and they can be serious, but also it's nice to have the awareness, because if you do have pain or a bulge and you want to know what it is or what it means, so it's important. So a basic definition of a hernia I tell everybody, including my wife and my wife's friends, is any organ that protrudes through the cavity that surrounds it. So if you were to sort of divide it up into inside your abdominal and thoracic cavity, you can have hernias there. But for the sake of this discussion and most discussions, people generally present with a groin bulge or pain in their groin, typically after they lift something heavy or they notice that it's been kind of creeping on and on and on for a long period of time. People that lift heavy objects, people that work for meatpacking industries and carry boxes and heavy things. Also, some people don't have any pain and they'll come to me and say, "What's this bulge?" So I typically walk them down the path of how to identify what a hernia is, and what there's a few sort of telltale signs. And you can have pain, you can have a bulge, you can have both, and sometimes you can have none of them. The typical sports hernia, which we'll talk about. But generally speaking, if you have a typical bulge in the groin, those are called inguinal hernias. You can get them on one side, the other side. And the reason for that is when you're in your mother's womb, for men, the testicles are in the abdomen and they migrate down into the scrotum. So there's a canal there, and that canal is supposed to collapse. And over time, sometimes, so there is a natural cavity that wants to go down into the scrotum in men. So what happens is over time, if you're lifting heavy weights, you can reopen that and you can get hernia contents, even intestine, down into your scrotum. Also, people will present with a bulge in their belly button, the quote-unquote umbilical hernia, or the quote-unquote belly button hernia, but it's an umbilical hernia. Or sometimes they present above the belly button. They all generally have bulge, they all have pain. Sometimes they'll pop it in, they'll state that it feels weird or it doesn't feel right. And then, the most important hernias to always look out for, I tell my patients, if you've ever had any surgery before, if you have an incisional hernia, which means you have an incision from a previous operation and you have a bulge at that site, which now means that needs a little more rather quick attention than, say, a regular little bulge in your belly button or even sometimes a bulge in your groin. All of these can be an emergency situation, but most of the time they're generally not an emergency situation. So let's say you have a hernia. Let's say we had a crystal ball and someone said you had a hernia and you came to me and we were talking about options at this point. Does it have to be fixed surgically? I generally, what I'll do is if I see a patient on the first visit and the hernia just sort of pops out, it doesn't bother them all the time. It pops out, but it pops right back in sometimes, and they don't have any pain, maybe on occasion when they lift something heavy, but they get through their daily routine. Then I'll usually do an observing, what we call a period of watchful waiting, and I'll do 3 to 6 months of watchful waiting. And if the hernia becomes worse or if it becomes a little bit bigger, they can always come back in at any time and say, "Now it's really bothering me, doc, can we just fix it?" And at that point, then I will proceed to fixing them. I don't generally like to fix hernias as soon as they come in. If they're getting through their regular day and they're not having a lot of pain and the bulge is very small, then generally what I say is we'll watch it for a little while. And patients are generally happy. No one really wants to have an operation unless they absolutely have to. Okay, so typically, let's say I've examined you and you have an inguinal hernia and I think it's time for us to go to the operating room to do a repair. Typically, there's multiple different types of hernia repairs out there. I personally choose a preperitoneal repair, which is basically a mesh repair. Almost everybody does a mesh repair, and that's a pretty standard operation. And I always tell patients, look, you're going to have a foreign material in your groin. So I don't like to operate if they're sick, if they have the flu, if they have an abscess or a boil somewhere, or any of those typical operations. Those are sort of general standards and general rules of thumb, but because you're going to get a foreign piece of material that's partially absorbable, but you're going to have some mesh is going to stay with you for the rest of your life. As with any condition, whether it's a heart condition or a hernia, you should always check up with your primary doctor. We know our bodies better than anybody else. You know your body better than anybody else. If you have a bulge, a pain, an ache, something that just doesn't feel right, sometimes it doesn't look right, you should always go and get it checked out. especially hernias. And you know, the watchful waiting part of the hernia and when not to operate is important, but also you got to get to the doctor to have that happen, to get to that point. So you should always seek medical advice, no matter what, when it comes to your body.